Okay, it's Jenna. We're at Shriners right now, and I just got my X-rays done, and to we're waiting for the doctor to come in. What?
I'm looking at the reflection in there.
Oh, what? So I have my questions, and yeah, so hopefully he'll let me film. If he doesn't, then kind of screwed. So bye. And it helps me remember them too. Okay. How long till I can function like normal, like walk and like take showers by myself after surgery?
So you'll take your first shower while you're still in the hospital. You'll have a waterproof dressing on. Usually that's about day 3. That's when your drain comes out. Your first dressing will be taken off after your first shower. You have to keep your wound dry for about the first 7 to 10 days.
Will someone have to help me though?
Typically the nurse will take you in the shower and help you shower.
Okay.
There's a big wide open shower with a shower chair,
And how many days is she in the hospital for after?
on average about 3 to 5. So surgery here is usually done on a Monday, and so usually by Thursday or Friday you're ready to go home. Again, the nurse helps you with the shower. There's generally a big shower chair for you to sit down on because it's not uncommon for you to get a little lightheaded. When you go home, you won't take a shower necessarily every day, but you won't really need to because you won't be doing a whole lot.
Yeah.
Typically, you should do a little bit more each day. So in the hospital, the first day, all you really do is get up to a bedside chair and back to the bed, maybe walk around the room a little bit. The next day, you will walk a little bit further, maybe out to the hallway or the nurse's station. The following day, you should be walking the hallways with the nurses. So usually by the 3rd day, you're walking not quite independently, but getting pretty close. And certainly by the 4th and 5th day, you're walking about independently, getting to and from the bathroom very easily, to and from the kitchen when you're home, etc.
Well, if I have to go to the bathroom like after surgery, like after I wake up, like how would that go about?
We'll have a catheter in the first usually 2 days or so until you're able to get up on your own.
Do you feel it?
No,
Yeah, you feel it.
I haven't.
You feel a little tug
You
in
really
that
won't.
area, but in general, it's a lot more tolerable than having to try to get up to rush to the bathroom because you've got IV fluids constantly running in your veins.
Oh.
And so you're gonna have to go to the bathroom a lot. And so you're gonna really want a catheter so you don't have to get up every time you have to go potty.
Will you put that in while I'm still under?
One of the nurses put it in once you go to sleep, yeah.
Okay. And then when is it taken out?
Again, when you're getting up readily enough to be able to get to and from the bathroom with some assistance.
Will it hurt coming out?
Most people don't even notice that it came out.
Oh, okay. Will I have to take meds like after I get home?
Typically, you'll still be taking pain medicine. The most common when you go home from here is Valium and hydrocodone, which is Lortab.
Okay. When I'm healed and I bend a certain way, I know you can't bend certain ways.
Right.
When I bend, will I just not be able to do it, or will it hurt?
You won't be able to do it.
All
It
right.
shouldn't hurt.
Okay.
It'll feel different, certainly.
Yeah.
It'll feel stiff. It shouldn't hurt though, but you just won't be able to do it because of the inherent nature of a fusion.
Is there any other kind of rehabilitation she needs after she's released from the hospital?
Typically, no. It's just a matter of increasing her activity levels each day. Mom's trying to beat you out to the questions.
Yeah, I know. I have that one written down. Will I have to have bone grafting?
You have bone taken from your spine, so no extra incisions, and then we also use cadaver bone.
Yeah. Will I have to have checkups after the surgery, and how many?
So you'll come back about 6 to 8 weeks after surgery, and then you'll come back 3 to 6 months after surgery, and 12 months after surgery, and a year, 2 years, 3 years, 5 years. But since this is the Shriners and you're 18, those post-op visits would be done with me in my regular office, where I see adults and children as well.
Okay. Where will my scar be based on my curve?
Right down the center of your back.
Like how long?
Well, again, that'll be determined by what your x-rays look like with you lying down and bending side to side. So that'll help me determine how many levels need to be operated on and then how long your scar will be.
Okay. When I walk, will I feel the rods in my back?
Some people say that they can. Probably that's more the stiffness that you're feeling than anything than actually feeling the rods, but I don't have rods in my spine, so it's hard for me to say that.
Yeah. How many vertebrae do you think would be fused?
Again, I can't answer that until I
Yeah.
see those x-rays with you lying down.
How long will my balance be off when I first start walking?
Mostly your balance is off because you get lightheaded when you first get up because of the blood loss
Well,
from
like the
surgery.
center of gravity, because obviously mine's not normal.
Well, actually, your center of gravity improves after this kind of
Yeah.
surgery, so we'll be shifting your trunk back to the
Yeah.
midline as
How
close
long
as
will I feel
possible.
like off my balance because of that?
I haven't had anyone tell me that they feel off balance
Oh, really?
afterwards.
I haven't. As you can see, all of her muscles are shifted to the one
I
side.
have that question.
Alright.
Since my muscles are very shifted to the side and they have been for a while, when they're back, like what will happen? Like, will they go back to normal?
Well, that's what people will call the rib hump or the
Yeah.
paraspinal hump, and we generally estimate that about 50% of that will improve. Being that your curve is mostly in your lumbar spine, I can usually get a much greater improvement of the rotation of the spine and therefore the hump on the back. And so that generally looks dramatically better afterwards.
So does it smooth out, looking normal?
Look
on
more
both
symmetrical,
sides?
so the one side to the other will look much more
With the muscle that
symmetrical.
hasn't been being used, is it like gonna be all like messed up?
Well, it's still being used.
Yeah,
So
but like not as strong as the other side.
well, it's still strong. It's still being used. What you're not seeing on this X-ray, you're seeing a curve.
Mm-hmm.
What you're not seeing is that the vertebrae rotate, and so your
Mhm.
muscles are still there. They're
They're
still
just
being
rotating.
used. They're a little shorter on this side. They're a little longer on this side. But the ones on the outside part of the curve are being lifted up, and that's what gives you your hump. The other ones are moving in toward your belly a little bit more, and that's why it looks like they're not there. So once I
Oh.
straighten out the curve, it actually lifts the other ones back up and
Mhm.
stretches them out. The other ones get, the ones that were longer get a little bit shorter, and ultimately they will start to work somewhat more normally.
Will my ribs be like rotated back to normal?
Much more toward normal, not
Yeah.
completely normal, yes.
How low do you think you could get my degree?
Again, I won't be able to tell
Yeah.
you that until I see those other films.
What are the risks, short term and long term?
So the short-term risks, the most common one would be infection. In the United States, it's about 3 to 6% of scoliosis surgeries in children will wind up with an infection.
What happens with that?
Usually you wind up having a wound washout, so going back to the operating room, it could be something as simple as cutting out a suture in clinic that is what's called a stitch abscess, or all the way up to going back to the operating room, opening up the entire wound and washing it out a couple of times, and then putting on what's called a wound vac, which is basically a big sponge that helps suck the wound closed over the span of weeks to months afterwards. There is a late infection that happens on average about 2 years after surgery that arises for various different reasons and requires going back in and taking out the instrumentation. But those are the two most common time periods that infection occurs: immediately after surgery within a couple of weeks and roughly 2 years out.
And that's only like 3 to 6% of the cases?
Roughly, yeah.
Okay. What are other risks?
The other risks, short term would be paralysis. That's the scariest one that most people face. And death, obviously some people would say death is not as scary as paralysis because you have to live with paralysis and everybody else has to live with your death. You don't have to. But paralysis happens rarely, especially in curves less than 90 degrees.
Has any of your cases been?
I have not run into a case of paralysis, fortunately. We do monitor the spinal cord, so we do a lot of things throughout the entire case to make sure that, number one, the screws are going into the right position, but then also that the correction is not causing the spinal cord any insult. And so throughout the case, we're constantly monitoring the spinal cord, and we do little bursts of monitoring during the procedure as well to help ensure that. And then at the end of the case, we always wake you up and have you go through a very specific neurologic test to make sure that all of your nerve roots in your lower spine are working as well.
Like what?
So when you wake up, I have you, you don't get to leave the operating room until you pull your feet up toward your head, you push down against my hands, you straighten your knees out on both sides, you spread your knees apart, you pull your knees together. And until you've done that, you don't get any pain medicine, you don't leave the operating room. And that's my confirmation that everything is working okay.
Okay. Will it affect my chances of having a kid?
It will not affect your chances of having a kid. It may affect your likelihood of having a cesarean section, although there's probably not really a great reason for that other than maybe a little bit tougher to get an epidural.
Yeah, that's what I was.
And
Because mine's so low, do you think it would affect the chances of an epidural?
it shouldn't, but sometimes an obstetrician hears scoliosis and they just automatically go to cesarean section because they don't want to run into any risks that may be presented to the child. So if the obstetrician wanted to call me and ask me exactly where you stopped and if they could get an epidural in, I'd be happy to talk to them about that.
Okay.
I don't suspect you'll be having a child anytime soon, I hope.
No. But, okay, I'm a bowler, so how long do you think it would be before I could bowl again?
It would be, I would prefer that you would wait at least until you're 3 months out.
Yeah. They told me 6 months last time I was here.
I would say in that 3 to 6 month time frame.
Will it, like, greatly change the way that I bowl?
I don't think it'll make you a better bowler.
No, but, like, will it make me, like, really, really bad?
It shouldn't make you a dramatically different bowler, but I wouldn't plan on it making you
Well, yeah.
a 300 bowler.
Yeah, no, I wasn't thinking about that. How long till I can work?
Usually I'm asked when can you go back to school in your age group. That's kind of 4 to 6 weeks, but work would be in that same time frame. But a lot of it depends on what you do for work. So, are you a cashier? Or
I'm a cashier right now, but when I'm getting the surgery, I'm gonna quit that, and while I'm healing, I'm gonna take this online class to be certified to be a daycare teacher or a preschool teacher in the state of Florida. So I would want to switch to that since I want to be a teacher.
So if you let's say you were already a teacher and you already knew all the stuff that you would have to do, chasing around the kids and picking them up and all the particulars of doing that kind of work, then I would say maybe at the 3 month point you would be strong enough and safe enough to do that. But learning to do all those things for the first time, probably I would wait until you're around 6 months out.
Okay. How much should I be moving each day after surgery?
A little bit more than the day before. It's
Okay.
generally a good rule.
How long will I be on medication and how will it affect my body?
It varies. Some people don't take the medication much longer after they leave the hospital.
Because I don't feel like they need it anymore.
Partly that, and generally the first several days after the surgery are the most painful, and it just depends on how your body deals with pain. Some people go home, they take the pain medicine for a few days, it makes them feel groggy and lightheaded, and they want to be more energetic and do more things, and so they start taking Tylenol in place of the pain medicine, and they get off of it within several days to a week or so. Other people come back at six weeks post-op, and they're still taking medicine and wanting more of it, and it just varies person to person.
Okay. After surgery, will I have like a morphine button?
Typically until the morning after surgery. We keep that going the day of surgery into the morning after, get you onto the oral pain medication as soon as you're awake after surgery, and try to get rid of the IV pain medicine as quickly as possible afterwards.
Can I run after it's all done?
Eventually.
Like it won't be harder or hard to?
Well, you'll tell me that.
Yeah.
The time point after about 6 months, the only restrictions you're going to have are no jumping on trampolines, no horseback riding, things of that nature. After a year, I release you from all restrictions.
Okay.
So if you wanted to run, that would be fine with me, but whether or not you're going to feel like running is a different story.
Yeah, like I'm not a runner, I just want to know if it's possible.
Sure.
Will the scar be sensitive to the touch? Because I know some people say that it hurts.
Usually it is, especially early on. Sometimes it can be for months and months and months afterwards. Generally over the course of somewhere between 6 months and up to 2 years, that hypersensitivity will decrease back to kind of normal.
So like if I touch it, like I'll feel the scar, like it'll
Well,
have
it's usually
nerves.
numb around the incision.
Oh, numb.
In a kind of a geographic area around the incision, you'll feel sort of numbness, but it's not.
But it won't like hurt.
Some people would describe it as pain and don't really want to be touched much, which I would consider hypersensitivity. But some people just describe a numb area around the incision that kind of slowly fades with time.
Okay. Will it be hard to lift things at first?
Yep. Yeah, it sure will be. And you should use your hips and your knees and keep your back as straight as you can afterwards for the first several months, and realistically forever afterwards, because that's how everyone should lift, even if they haven't had scoliosis surgery. But eventually people start getting to the point where they don't really, they sometimes forget that they've had surgery, and as you get back into life, if it doesn't hurt, then it's probably okay to do, but realistically, you should use your hips and knees and keep your back straight to lift even now.
I've seen in cases after they get the surgery, their degree will be like a certain number, and then like a week after, it would be a little bit higher. It's like, so there's like possibilities of it like increasing.
That's pretty rare nowadays that we use what are called pedicle screws as opposed to hooks. We used to see that more commonly when hooks were used. Probably if you're talking about someone who had pedicle screws, it's either an error measurement error or some other minor little factor that would change the curve measurement by a couple of degrees.
But nothing
so,
big.
While radiographically, in other words on an x-ray, that might be noticeable, but you would never be able to see that clinically.
Okay. What are the chances of me having to get another surgery?
I generally quote about 10% for all comers. So infection, winding up needing to go back to the operating room, needing a surgery at some other level at some point during your life, whether in the short term or the long term, the bones not healing together, and ultimately a screw or a rod breaking, some combination of all those things, somewhere in the neighborhood of about 10%.
What's like the percentage of like it being common for a rod or a screw to break?
It's pretty uncommon in a non-smoking teenager for a rod or a screw to break. I personally have had 3 patients in the course of 3 pediatric patients in the course of the last 6 years for a variety of different reasons that have either dislodged a screw or broken a screw or something like that.
But it's never been like the full-on rod.
Sure, yeah, you can break a rod. I've not had a pediatric patient do that personally, but
How does that happen?
Just like a paper clip, if you bend it enough, eventually it'll break. If the bones don't heal together, there's still motion there, and if there's any residual motion, it slowly.
And that's why you
continuously
fuse the
bends
vertebrae?
that. Right.
Okay. Well, how will it affect my sleeping?
Well, that's a tough question. I don't know that I've ever been asked how it will affect your sleeping. It shouldn't really affect your sleeping. Initially, obviously, it will because you're
being
awake.
uncomfortable.
Well, pain, obviously, immediately after surgery will affect your sleeping, and that should slowly get back toward your norm, whatever that is.
Like I won't feel it when I'm laying down, really?
Typically, you feel it less because you don't have your hump anymore.
Yeah.
You have less of a hump.
How long is the actual surgery?
It varies depending on the number of levels, but on average around 3 or 4 hours.
Okay. That's it. Oh, what complications am I susceptible to?
Remember we covered those: infection,
Oh.
paralysis, death.
But like my personal, from like the way that my curve is, like organ wise.
Still those same ones. You don't have any specific risks that would be more common in you than
Okay.
someone else.
So there's nothing like that you would have to especially look out for me that you know of right now.
At this point, I don't have anything specific other than what every person undergoing a spinal deformity surgery would be subjected to.
Okay. All right, that's everything. Thank you.
Alcohol.
All right, hey guys. Hopefully no one's watching me. So I just got out of the appointment and like it went okay, I guess. So we're getting an MRI done next week, and then we're gonna send it over to the hospital, and then they're gonna schedule me for when I'm gonna get it done. I'm not like 1000% sure if I'm gonna get it done or not, but I'd rather have the date if I do decide, and if I don't, then I can just cancel. So I just like, I thought I was kind of sure about it, but last night I realized that I'm not at all. And I just don't know. So like, he gave me good answers to my questions. I'm gonna look over this questions video of all the answers and the last one that I did when I came here, just to kind of wrap my mind around everything, because when he's saying it to you like in the moment, like you don't really take everything in and you can't like replay it, you know. That's why I'm glad that I found these things. But yeah, so some questions were unanswered because I have to have certain x-rays done for them to be answered. So I'll find out those answers too. Like fact-wise, going into it, I'm like, yeah, sure, I'll get it done. But then it's like, add like emotions and stuff to it, and it makes it like 1,000 times harder because I'm so scared. But yeah, so if you guys have any comments, suggestions, something funny to make me feel better, please let me know. And I gotta go. Bye. You're scaring the squirrel. The squirrel was watching me film. Where are you coming from?